Hello, everyone. Good morning, good afternoon, good evening, and I hope not good night. It's great that you're here with so many people. Lovely to see you. Maybe some practical information first. Um, this webinar will also be recorded, so you will be able to see the recording afterwards. We also record it to make it available for other people. Maybe you could share it then with your colleagues if you think it might be interesting. And other people can also see the full recording afterwards. The people that are present here today, you can download the presentation I'm sharing, and you can also ask private questions to me. Private questions because can be confidential of nature, of course. So if I think it's better not to answer here on a recording, I can follow up with you via email. You can also send me an email via my email address, arne@academiclabs.com. So first short introduction, I will give a short introduction, very short presentation, and then give you a live demo of the platform, show you the capabilities, pretty concise, so you have at least a first understanding. We can, of course, always have a personal call with you to explore how we could help you with your specific needs. And people staying until the end can also get a free access period to try out the platform along with 3 colleagues. Okay, so short introduction. I'm Arne. I started with AcademicLabs 5 years ago. I was doing PhD research in aging biology. I was pretty ambitious, like many scientists starting out, aiming to win the Nobel Prize by slowing down aging so we all stay healthy and look good for a long, long time. But I noticed this was not going to happen. There's so much friction along the way that it makes it so hard to turn bright ideas that you may have into real impactful breakthrough discoveries. And you lack certain expertise to really work on your good ideas. You need expertise from different perspectives. You need advanced instrumentation. You need to have certain information, and it's so difficult to get all the information. So I noticed that my motivation was going down over time, and I was working more and more on the superficial ideas. So eventually, after 4 years, I said, no, let's stop. Let's build a platform to solve this. Let's eliminate all the friction that scientists and innovators experience, so more of them can actually turn bright ideas into impactful discoveries and innovations. So that's why I started Academic Labs. We're happy now that you can work with leading pharmaceutical companies like Janssen, Novo Nordisk, GSK, Servier, Boehringer Ingelheim, etc., leading cancer foundations like Cancer Research UK and some more, as well as biotech companies, lab suppliers, academics from top universities, etc., but also companies as well from other sectors. So in this webinar, I'll show you how leading pharma now use our platform to find ideal academic partners, but also other opportunities, find what competition is doing, find interesting new science and things like that. And all that in just minutes or seconds even, and you can do it all year long. So I will show you in a short presentation, I'll give you some background and then show you live how this works. So in general, we see three big trends in this R&D ecosystem. R&D is increasingly complex, requiring more and more in-depth specialization. Easy questions are already being answered in the past decades. So everything gets more complex. We specialize more. It also means we need to collaborate. We need to collaborate across borders of organizations. So we need to leverage and collaborate with external experts across countries, between universities and companies, for example, and between very niche experts. So kind of crossing domains, which is not always easy. And I think the best example has been now with the COVID situation, the extreme collaboration that now took place. Well, vaccines were developed in a year time, less than a year time, compared to on average 10 years. So if we collaborate, we can do so much more. At the same time, we see that information is getting more and more accessible, not just for the top institutions or the top companies, but for the more global world. This open access movement is taking place, open data. And at the same time, new technologies are being developed that actually give very advanced toolboxes to every bench scientist across the world. And this together makes sure that results in that great ideas can really come from anywhere. So I think the days are over, and that's also what the companies are saying to us. The days are over that we just need to work with the top institutions because that's where the big ideas come from. No, that's no longer the case. And the big institutions are also harder to collaborate with. They're already so busy. They're maybe more demanding financially, etc. So there's maybe some interesting opportunities in the subtop or the other one, the other universities as well. And then there's also an exponential growth of scientific output, as we all know, and also new research. So as a human being, it's very hard to stay on top of all this. So we need ways to sift through the noise, to stay on top of the most relevant information, and then be able to actually connect the right dots from all this information to take the best decisions. And if we ask today how people are doing this, and we always get the same answers. So each of us have their own network that we rely on, that we trust, but that also results in just a few options that you can count on. You can also go to conferences, which are these kind of ad hoc moments where you could meet people, but it's not very systematic. Then people often rely on publications, which is kind of a view into the history. Because if you want to collaborate, you want to find people you want to know what they're doing today, because the research they're doing today will be written down, or the data will be analyzed in 2 years' time. The publication will be written a year later. It will be peer reviewed another year, and then before it gets traction, you also get some months and often a year or more. So if you just rely on publications, you're always kind of running behind. And at the same time, there's so much information, but it's so scattered on so many different databases and government portals, university websites. So you need to kind of puzzle things together, which is a slow process. It's annoying, also resulting in often people not doing it because we're all busy. So we don't find the time to do so. It's not pleasant. So all of this results in more failed projects than what we wish to. We waste a lot of time we could waste with our expertise as scientists, as business developers, etc., on more valuable work, and instead of puzzling things together. Also, decisions are now often based on just a few data points, and great ideas are often just somewhere at the back of the mind or in a drawer gathering dust because you don't have the expertise and insights you need to act upon them. So it's kind of finding the pin in the haystack, and that's what we want to solve, and already solving, at least what our customers are saying. So we really allow you to go beyond your personal network to really access a global network. We have all experts in biology, medicine, and chemistry worldwide. We have more than 120,000 research groups at 700 leading universities. So in just a second, you can access the experts you need. Also, we gather information on what are these research groups at the university focusing on today? What are their current lines of investigation? What's their mission? What are conference proceedings and abstracts and preprints they have? What are projects currently being funded and taking place as we speak? And same with clinical studies. And the same is true not only for research groups in university, but also for companies. So maybe interesting biotech companies, or what do pharma companies do today? So it gives a more forward look towards what's being worked on, what can be investigated, and who should we maybe align with today, so that once something gets out, we are the first in line to benefit from it. And as a last point, instead of puzzling things together, we bring it all together in one place. So you can have a 360-degree view on experts, on research groups, on companies, so you know who are they working with, what are they doing today, what have they done in the past, who are the key players there, etc. At the same time, you can use it to find publications with all kinds of filters to cut through the noise. You can use it to find patents, to find clinical studies, funded projects. Very difficult to do that today, or there's some databases, of course, but they're scattered, or you only have access to limited data, or the filters are almost not there. So we actually make that process a lot easier. And that's what the customers are telling us, that they switch to academic labs via what they used before, like PubMed or Scopus or clinicaltrials.gov, etc. So with Academic Labs, we really can find other academic experts, but also companies and scientific information in seconds in one place. So the transformation that companies are going through thanks to Academic Labs, is they can be much more systematic in leveraging external expertise and insights. With all this information at everyone's fingertips, more than 100 filters, custom alerts, you can actually screen, identify, the ideal information and experts. You can evaluate them in depth like you can nowhere else. You can engage with them. You can engage with experts, contact them. You can collaborate with your colleagues, building a library of information and opportunities and potential partners, and stay updated on the most promising opportunities so you never miss out on something. Also, you can be much more objective. Instead of relying on personal networks, ad hoc meetings, and a few top institutions, you can use scientific criteria, but also other criteria relevant to you, to objectively assess who is the most suitable expert according to your specific needs, and that case by case, because that can change. If you use Scopus, for example, you can only use publication criteria, which is not always the most relevant as a company, as you know. You can see some quotes here. So people say, okay, it's much better than PubMed or Google or other systems to quickly find exact insights that you need. Unbelievable how much information you can get in a few clicks. A lot of options to drill down, very impressive, and it works very fast. The third point is they can be more proactive, and after this we will do the demo. So you can be much more proactive because you don't have to wait until things get published. You can find who's doing what today, get in touch with them, see what could be interesting ways to collaborate, or once there's a new technology coming out, you're the first in line, for example. Or if there's new project ideas, you can work together on that and get, for example, NIH funding, European funding, etc. And I think one of the best ways is in our model, we said, no, we don't want a system that can only be used by a few people in a large organization. We want this to be accessible for everyone. So our business model is accommodating that as well, so that scientists in drug discovery, development, clinicals, business development, CI, they can all use our platform. And we get actually feedback from all of them that this is exactly an interesting tool, very useful, very valuable, something they haven't seen before for their specific research needs. And that's something that we actually really focus on to make it very easy to use. And that's also what people are saying. You can see it in the quote. It's so easy that they'll actually use it. And that's very important because otherwise you don't use information that is accessible to you. So to summarize, with AcademicLabs, with all this information and experts in one place, you can be more systematic, you can be more objective in evaluating opportunities, you can be proactive, and everyone can use it. So that's very important. Now, I'm going to share a live demo now. Share screen. Okay. All right. So if you get in our platform, in the dashboard view, you get an overview of who are the research groups, how many research groups you have, how much ongoing research of these groups. So we have more than 120,000 groups manually gathered with their information like mission, ongoing research slides, professors, and things like that. We then combine it with all the other information like projects, clinical studies, patents, publications, collaborators, etc., which we gather automatically. We have all the researchers with more than 10 publications in biology, medicine, or chemistry, as well as the group leaders. We have funded projects from NIH, NSF in France and Belgium, and European funded ones, IMI and more, and we continuously add more projects from different regions and countries, foundations. We have clinical trials, not only clinicaltrials.gov, but also the EU register and WHO, so very international. We have publications like PubMed, 30 million, but also all the publications that are citing PubMed, more than 20 million. The last years of chemistry, preprints, bioarchive, STEM conferences, and we're going to expand that step by step as well to other disciplines. And we also have all the patents since the last 5 years from the EU and US. We have some technology offers, it's in beta, so we're going to expand that. We have the Horizon Europe funding calls, and organizations, companies, but also academics can offer services like equipment that they have available, also experiments they can offer, other services, etc. Now, I prepared a few queries here. So if I would search on CRISPR, what do I get? In a second, I get 7,000 research groups, 54,000 researchers, almost 1,000 ongoing research programs of these groups, funded projects, 4,000, 42 clinical studies on CRISPR technology, 30,000 publications, 3,000 patents, and technology offers. So all of that in just one query, you can get this information, and then you can, of course, deep dive. Here you don't see many filters yet, but if you select a category by the category selector or clicking on category, you actually see all kinds of filters and you can drill down. So you can use a query. It, of course, takes into account synonyms, so you don't have to worry about using the OR operator. You can use, of course, operators, but you don't have to worry about that. For synonyms, we add those automatically. You can also create an alert in one click, and you get every Wednesday, an email if there's new groups matching CRISPR, new publications, new projects, etc. So that's something, it takes maybe 20 seconds, do a query, create alert, bam, you stay updated. But you can not only use this to find information on a certain topic, you can also analyze competition. So let's say I'm interested in knowing more about BioNTech. I think everyone knows BioNTech these days. So you can actually see here 43 groups they actually collaborated with. You can see in how many publications they were mentioned. For example, in this case, this is a group focused on lupus research. If I okay, if I click here in the group, I click BioNTech because that was my query. I can go down. I see the one publication this group has where biotech is mentioned, and you can see here the mentioning of BioNTech. In this case, it's not a collaborator. It was mentioned, it was referred in the publication. So it allows you, it doesn't mean per se that these are all collaborating research groups, so you can deep dive to see what is really the connection with BioNTech in this case. You can also see the researcher, of course, Mr. Sahin of BioNTech, and then you can, of course, find also other people working on BioNTech, but also people that have collaborated with them or in their publications mention BioNTech. You can see an ongoing research program mentioned by a group. So here you can see an example of what they're doing. You can see funded projects where they're involved. In this case, this BioNTech is a partner of the VUB and University of Zurich on this project. You can see clinical trials, 52 that they're involved in. You can see publications they're mentioned or one of the authors. You can see patents where they're mentioned. So in one view, you get all this information and then you can deep dive. You can click on patents and identify all the patents, what dates, etc. So this just to give an idea of what how you can use it. You can use all categories to search for a topic, but also to analyze competition. Now let's dive into one of or each of these categories. Let's start with research groups. So if I search for CRISPR, of course, Doudna Lab comes first, the inventor. Of course, 7,000 groups if you want to find experts to consult or to get as advisor or collaboration. You don't have time to check 7,000 groups. So we put a lot of filters in place. We have sorting options. You can sort on the ones that are most cited on CRISPR, the ones that publish most in top journals or from top universities, things like that. And we have some, instead of using independent or individual filters, we also combine some interesting filters, like we call them quick filters. For example, people who published in the last 3 years in top 10 journals. You can just do one click and see the results. Or rising stars. Then we do the same thing, but we combine it with people, early career researchers that have about 20 to 50 publications in total. So in one click, it selects actually the different filters, and you can see which journals are selected. So Nature, Science, Cell, Lancet, etc. So it now means these 65 groups have published in the last 3 years in these top 10 journals, and they have in total 20 to 50 publications. And it's sorted by the ones that are most cited on CRISPR. So you can see here different groups. You can see the first one, 28 publications on CRISPR out of 36 publications in total they have. You can see 20,000 citations on CRISPR publications out of 24,000 citations they have in total. You can, of course, see the university and the country and the group leaders. And you can actually see by year how many publications they have on CRISPR, as well as the number of citations. So in this case, they have a publication in 2013 that has got almost all the citations on CRISPR. You can also say, okay, I want to find groups that have collaborated with, for example, a company or a hospital or governments. You want to see them by organization, so you can see most in Harvard are these rising stars. You can see them by country. You could say, I want to see those with activity in a clinical trial at a certain period or a certain phase. So maybe you want to find people that have experience in phase 1 trials, or people that have Horizon funding or NIH. So NIH, BAM. Okay, these 14 rising star groups, they have also had a funded project on CRISPR. So let's say this one seems interesting because they seem to be in the last years more active on CRISPR. You can see by the dark blue ones, they have a funded project, publications, for ongoing research, and a mission where CRISPR is mentioned. So interesting group from the University of Virginia, of Mazar Adli. So now you can see a profile of this group. So it's kind of 360 view. What's the mission? What are they focusing on? So they developed certain expertise. They're using this technology. Currently, they're combining this. They have some publications in Nature, I see. So you can see we are actively developing this. So it gives you a good idea of what they're kind of doing. You can also see more than just keywords. You can see what is their current lines of investigation. And then you can look into details. You can see what they're actually focusing on these days. That can give you, that's of course very important if you want to collaborate or you want to get advice. You want groups that are focusing on this topic with many people, because then you have more expertise, people share insights and networks, but it also means they're very on top of it. You can also see they have a funded project on CRISPR. You can see 2 million, not bad. It's NIH. They are kind of midway the project now. This is what it's about, and you can find the details here. You can see publications, so we show the top 5 based on the number of query matches or keyword hits, but you can see all the publications. So now I'm doing a search in the Adli Lab. I see they have a total of 49 publications. If I click CRISPR, my query, you can also do another query, of course. You can see they have 17 publications on CRISPR. And then the question is, okay, I can look into it. This one is clearly the one with all the citations. What is it about? You can link to the full article, etc. You can actually also see about the 17 publications, what are the concepts of these publications, to have a quick understanding instead of having to read the 17 titles or abstracts, to see if it's already relevant or not. And you can use them, of course, to filter down. For example, CRISPR related to cancer. Okay, these are the 6 publications. You can open the filters, and you can actually see who are the co-authors. You can immediately go to their profile. You can see who they collaborate with on cancer and CRISPR. So these are the collaborating research groups. You can immediately go to these profiles and see what they're currently focusing on. You can filter by, you can see which areas they publish these CRISPR publications. You can also filter by mesh terms if that would be relevant. In this case, you can see when did they publish on CRISPR. Let's say if I remove cancer again, the 17 publications, you can see they started in these years. Maybe I'm interested in the last 2 years. So before, if I go back, before they published like in Nature Biotechnology, Nature Methods, Nature Communications, is it still the case in the last 2 years? No, they do it in PNAS, so it's sorted by a journal rank. So that could be an interesting indicator. You can also see for all the publications now on CRISPR, okay, which ones are in the top journals. You can use it as a filter. I want to maybe see the ones only with more than X amount of citations. Are they collaborating internationally? With which universities? Do they maybe work with a company? So you can look into that, or with other health organizations. You can of course click one and then see, okay, who are these organizations? What is the article about? You can also easily find if they have a review or a clinical study report to immediately go there. So in this way, I think key message here is that you can use these filters to analyze who do they collaborate with, what's the quality of the research. You can immediately, everything is adaptive, and you can actually quickly jump from one place to the other, get new insights, and go to another profile to find a collaborator, for example. And if you think a group is interesting, there's many things you can do. You can send them an email via our platform. You can follow them. Every time they have something new, you're alerted. You can go to their website for more information or get their email address or phone number. You bookmark them, so you can bookmark them and share it with colleagues or store everything related to the project, etc. So this is a flow, finding research groups based on all these filters and sorting options. Quickly go from 7,000 to 50 rising stars, 10 that are active today with a funded project, evaluate them, what they're doing now, what have they done in the past, what's the quality of the research, who do they collaborate with, interesting, okay, I get in touch or I share. So you can actually do this, if you're practiced, you can do this in less than a minute, actually. I showed you for research groups, but you can do exactly the same for researchers. And for research groups, you have 120,000 groups from 700,000 leading universities. A bit less coverage in Asia, because there the websites are less sharing information. But from a researcher perspective, we have real pure global coverage. Everyone with more than 10 publications in biology, medicine, chemistry. So if I do a search on CRISPR, I find the 55,000 researchers. Again, I can filter on all these criteria. I can also look at these specific term suggestions here to deep dive into specific information if I would be interested in that. Something that a lot of people now are using is I want to find researchers experienced in collaborating with companies. So that's about 2,500. And I'm interested in, for example, this pathway. So these are the 600 researchers that focus on CRISPR and this pathway and have experience with companies. Then the question is, from which organizations? Where is the density? Where are the hotspots? Clearly Harvard, Chinese Academy of Sciences, but then also interestingly, companies show up, Novartis, Genentech, GSK, AstraZeneca. So you can actually use this information to find hotspots or to find the key researchers at Harvard. Let's say at Harvard, who are the key researchers? Benjamin Abbott, clearly, he's number one. You can click on them. Okay, you can find more information about what they're doing, the project, the publications, the key interests, go to the lab for what they're doing today, and get in touch if that would be relevant. You can also see, for example, Novartis, who are the researchers involved with Novartis who are doing this. So you can actually see within companies who are experts, not only in pharma companies, but also maybe interestingly smaller biotech companies. Also interestingly, you can see here's the organization per country. You can actually just go country by country and see in the US, for example, 80 researchers based on the query CRISPR and the other criteria that we selected out of the 13,000 researchers in Harvard that we have are matching CRISPR and our query. You can also say, I only want to show non-academic organizations, and then you can see the companies, but also hospitals and things like that. So it quickly gives you an idea of maybe some interesting biotech companies or other companies. So, and this approach can also be used for finding the hotspots for groups, but also hotspots for publications. I'll show that in a minute. Of course, again, create an alert, and you can actually get all the new researchers. And if you select a few things, let's say I want to have all these 80 people, these experts from Harvard, experience with CRISPR and collaborating with companies. I save them all to one bookmark folder. It's just one click, bam, everything is in there. I can share it with colleagues. For a business developer, this is often useful to share them with scientists internally, for example, or to share with other colleagues to then do an analysis. You can also export and get basically a CSV with all these researchers and the link to the profiles. Interestingly, if you share this, there's a link to the profiles, and those people don't need to have access with a paid account to AcademicLabs. They can visit the profiles. So that's also something a lot of our customers really love. So now I showed the research groups and the researchers categories. There's plenty of things you can do, but there's no time to go into details here. But if you want to know more information, happy to set up a personal call. Few small things then for the other categories. Something that is often used as well is using the ongoing research. This is basically the lines of investigation of the research groups that they share on the website, for example. So if you do a search for CRISPR, you can quickly understand what is actually being done on CRISPR these days. What is it being used for? You can then always go into details. You can also, of course, CRISPR cancer. Then, of course, it also takes into account tumor, neoplasm, and things like that. So you can see, okay, where's CRISPR used for cancer? And then if you click one, you'll find some more information about what they're doing, what will they focus on, what else is this lab doing today, what are they focusing on, who are their key researchers at the university. You can save it, of course. So this is very convenient to like spend a few hours or a day just going to, or even a few minutes just browsing through it to understand on a specific topic what's being done. You can imagine if you hire new people or if you have a new project, that people need to be onboarded. They don't have per se in-depth experience around a specific topic of the project. So in this way, they can quickly understand who are the key experts, what's being done today. And as I will show in a minute, you can find the key publications, the key reviews, patents, and things like that. You can also see where are the countries with most research on this topic today, which universities. Harvard is again at the top, and things like that. Very important here, the alerts, of course, if there's some new ongoing research, that's super interesting to know. Funded projects. So with funded projects, I did a query here, early detection cancer. If I open the filters, well, maybe first thing you can sort by, for example, highest funding amount. So you see the ones with the most funding first. You can then see, I think most interestingly is the projects that are currently taking place. So let's say you filter from 2018 onwards. These are the 800 funded projects on early detection in cancer. That's a lot, of course. You can see in which countries, which organization types, which organizations, which type of funding. So we have the Horizon funding, we have the US, Belgian, and French funding. Later on, we will add more. So you can filter by NIH or Horizon 2020 and things like that, and then see, okay, who are the organizations who have won most funding. Could be interesting, for example, to select companies that you might be interested in, like finding interesting maybe biotech companies or other companies. Clearly, Kaiser Permanente is here the one with the most. So if you want to know more about them, you can see, okay, what is this project about? $13 million. This is the project, the details of the project. You can see which kind of funding. For some people, it might be interesting to know what this is. Or use this information. You can click on every one of these people in the project. So if I click on one and you go to the profile where it does a search, you can see what they're focused on. See their publication and citation track record, the projects they have, the publications. You can search in their publications again. You can see, also interestingly for this company, Aruna, who did she collaborate with? Okay, she worked with Zen Group and this group and this group. From which organizations is it? So Washington, Pennsylvania. So this is interesting to know. You can also see which other authors did she collaborate with. And then you can go, okay, maybe Zen Group is interesting. You can click and you go, and you see, okay, the Zen Group, this collaborator of this company, some interesting research. What are they doing? So you can easily jump from one thing to the other. So for funded projects, it's also a very interesting solution. As you can imagine, now you have to go to Cordis, to NIH, to different places. They're also not easy to search. So we bring it all together, we connect it with experts, the companies, the universities, for you to actually get the details that you need quickly. Create an alert is again easy. Bookmarking things all in one place, having all the projects to share with colleagues can be interesting. Clinical trials. I just did a query COVID-19. Already, I was surprised, 8,500 clinical studies. Interestingly, if you try on clinicaltrials.gov, you don't see all these details. So here you can immediately see how many in each phase. You can see, interestingly, who are the main sponsors. That's something you don't see in clinicaltrials.gov or the other databases. You can see who are the key investigators, who are the key collaborators. You can see by country how many clinical studies, and then use that as a filter. The disease is obvious. This can be useful for if you search, let's say, CAR-T or CRISPR, for which disease is this technology already in a clinical study, and who is then behind these studies. Let's say I'm interested in knowing more about clinical trial, let's say AstraZeneca. What are they doing? So I select AstraZeneca. Okay, 3 trials in phase 1, 4 and 2, and 5 in 3. what are the statuses, what are their abouts, so you can see who they collaborate with, who are the investigators. Okay, the walls files. So you can see here first, of course, the details. You can link for the full details. We will also add more information soon, but you can, of course, find the protocols here. And you can actually see, okay, they collaborate with this group. Who is this lab? What are the interests and the ongoing research, the projects, the studies, the publication, the patents? Can I get in touch with them? Yes. So very easy to jump from one thing to the other again. You can also see, let's say that would be interesting. If I look at collaborators, Bill and Melinda Gates Foundation, what clinical trials are they having, for example, which phases? And who are they working with? Oxford, Washington, these kind of companies. I don't know, Novavax, what is this? Interesting. And you can do a search for Novavax, for example, on a platform to figure out more information about them. Set up alerts to know if there's a new clinical trial in a certain phase or from a new company or organization. Our platform is also, I think, almost mostly used as well for publications. So I think many of you use PubMed or Google Scholar or Scopus. So if you do a search, let's say on CAR-T, what you don't have often in these platforms is who are the top authors on this topic. So Carl June is clearly the key opinion leader here. You can see the research groups. You can see that have most publications. You can immediately go to that research group to find more about what they're doing today. You can see what they're focusing on, etc. What a lot of people are doing is checking, for example, where are the hotspots. So let's say per organization, see organizations per country. If I look at the US, I see, okay, University of Pennsylvania is here, the key, probably because of Carl June, and then these are the other ones. Maybe I want to see the non-academic organizations, mostly hospitals, but Amgen here is also visible, Eli Lilly. So it could be interesting to also see then, for example, if I click Amgen, I can now see the 64 publications on CAR-T from Amgen. I can actually see, and that's very interesting, I think, which research groups are they collaborating with on CAR-T. So you can actually then go to these profiles, so you can see these collaborators and the co-authors. You can see the concepts of these publications, so you can see immediately what is it about. And maybe you don't want to see it historically, but maybe you want to know, I'm just interested in the last 2 years, the last 3 years. These are the 17 publications. These are the groups they collaborate with. These are the concepts where it's about. If you're interested in CD70, just click CD70. This is the publication, and these are the people they collaborated with. This is, of course, the abstract, the link to the full text, and the authors. So they worked with Allogene, so you can see different authors from the university as well. So in this way, you can quickly understand, maybe from a competitive point of view, but also find, as I showed now, but also you can use it to find, for example, if I go down here, I go to reviews. I want to find all the reviews, not on CD70, but CAR-T in general. But reviews that got, I don't want to see all the reviews, the ones that have more than 20 citations. So in this way, I can see the ones that really get some traction, the reviews. I don't want to see the old ones, but I want to see the last years. So these are the interesting ones. 82, then I can see which one do I want to read. Maybe I want to sort on the most cited or the ones from top journals first. So this one is from Nature, Science. You can see who are then the labs with most. You can see which are the people, the authors with most. And you can actually see, is it the same universities now showing at the top or the same companies? So you can actually see if I look for quality or certain other criteria, is it the same? Is the hotspot the same as if we just look historically and just at quantitative numbers? So it is a search engine to find publications, but you can get so much more information from this than what you can get with other publication search engines. And what a lot of people are using is create alert, one click, bam, it's done. Every Wednesday, if there's a new CAR-T review that gets now more than 20 citations, so it gets traction, well, I will be informed. I will get the publication. Last thing, patents. Same thing, you can search for something, let's say CAR-T. I want to see only the ones that are the patents that are granted in the last 2 years. I want to find the newest information. So these are 354. I want to see who are the leading applicants. Okay, this University of Pennsylvania again, Novartis, because a few other smaller companies. Could be interesting to learn more about these other companies. Of course, you can filter by country to only see the ones in the US or China if you want to see those, maybe in Japan. But you want to see, okay, maybe if I work with organizations in Asia, that we could have a license to use technology in Europe or in the US. So in this way, you could find then who are in Japan the major organization of patents, who are the major patent inventors. Then let's say, okay, this is from a university. So maybe provides an opportunity to license a technology from this university. You can see the abstract, you can go through the claims, and you can go to specific parts of the patent immediately. So to save you time, we implemented this, so you can quickly find what's relevant, find more information about the authors themselves, the inventors, and see the PDF. You can see the historical details, of course. So you can easily find information, find interesting licensing opportunities in this way. You can also see, so you can use this all from a competitive point of view. And if you want to understand everything that Novartis has on patents in the last 5 years, well, that's it. If you want to see only the granted ones, or you want to see who are the key inventors on those, you can immediately see them here. Again, alert creation and saving everything to the folder is possible. We also have technology offers from a few universities, but this is in beta. We're going to expand this soon. If you're interested in this, happy to hear your thoughts, because we have some ideas we want to ping pong with you to make sure we implement it in the right way. We're also going to implement a way to find startup companies, biotech companies, and profiles of pharma companies, so you can actually have a full understanding of those companies. I think that's for business development people, can be very interesting as well. Funding calls is, of course, also possible from Europe to find, for example, medical device, the 3 open funding calls with the information on the funding call, with the necessary links, how much funding, how many days left till the deadline. And last thing, if you have all the information gathered in a bookmark folder, so if I have now this one, for example, my bookmark folder, I can actually search within that. Say cancer, I search. So this is basically, the bookmark folder is a mini version of our platform. You can do all the same searches and filtering. So if I click on these groups, I have again all the same filtering options. I can see by country and organization, and the publications are automatically updated, the profiles as well. So this is very powerful to work with. Instead of exporting and using Excel, you can invite colleagues that can add stuff or can view things. You can add a message, of course. They don't need to have a paid account to access a bookmark folder. So this is a very powerful thing to collaborate with. Of course, you can export things as well in the CSV. So I think in this way, I summarized the most important information. You can always go to our website, try a search, or with Get Started, you can sign up and see a few top results. But also happy to organize a personal demo. You can reach out to me via my personal via my email that I shared, arne@academiclabs.com. Also on our website, you can contact us directly. I have to stop sharing now. Okay. I think you can still see my PDF presentation. Okay. So for everyone listening to this demo, we can offer you 1 week of free access to Academic Labs in the next couple of weeks. You can also invite up to 3 colleagues. So what we want to do is we organize a session with you. If you can let me know when you'd like to start, we can organize a one-on-one session or 1-on-4 session where we actually have a tailored onboarding to show you, based on your specific interests, how to get the most out of the system during this 1 week free access. And then, of course, you can already get value from it. If you want to continue, we're happy to discuss the modalities to further have continued access to Academic Labs. We're always there to help you along the way. via explanations, via video, in a personal way, one-on-one onboardings, organizing sessions with your organization frequently, organizing webinars. So if you're interested, please reach out to me and we're happy to set you up. All right, to conclude, thank you for everyone for attending as well as for viewing this webinar after the event. Academic Labs, we bring together all information and experts in one place to really make it as easy as possible for you to find exactly what you need. We're continuously improving. What you see today is just the beginning. It will even improve a lot. We work closely with all our customers to continuously add new functionalities, add new data, so you can benefit more from the solution. All right, thank you very much, and I hope to hear from you and to help you further with your business challenges. Thank you very much and have a great day. Bye-bye.